My name is Sydney Mufamadi. I come from South Africa, born and bred in South Africa. I spent my teen years as an activist in the struggle against apartheid. So the struggle against apartheid, the struggle for change, struggle for freedom has been my life ever since. I am now 65 years old, and having been in public life for almost 50 years, some of the landmarks in the journey had been that I was a foundational minister of safety and security in the government of President Nelson Mandela, which was the first post-apartheid government. After that, I served 2 more 5-year terms as a minister of government. I then went into academia where I became a director of the Center for Public Policy and African Studies at the University of Johannesburg. I'm currently a professor of practice in mediation diplomacy who is on secondment to the current President of the Republic of South Africa as National Security Advisor. Well, I was diagnosed 15 years ago, now almost 16, as suffering from glaucoma, and ever since I was placed on chronic medication. But I did witness over that long period of time a degeneration in my vision. As a matter of fact, I quickly lost completely vision on my right eye, and the attempt to salvage the left eye was not successful, as my optic nerve degenerated to a point where I have now become legally blind. I can still see with my left eye, but there is very, very, very low vision that I'm suffering from. So I made inquiries, particularly after being told by ophthalmologists both in South Africa and in the United States of America that there was no way my vision could be retrieved. This is permanent and total blindness, which I am facing for the rest of my life, because nerves cannot be regenerated. However, I came to understand that there is a therapy or treatment which really has become available as a result of research by scientists. It is not It has not been as yet mainstreamed, that's what I was told, but it is something that as a patient try to find out more about so that I can try my luck there. And indeed, in the process, I got to know about European wellness because there is a medical practitioner in South Africa who is in touch with European wellness, and that's how I found myself traveling all the way to South Africa last year to do my first acquaintance with the institute, and I then was introduced to the treatment. I came here exactly a year ago. That was May 2023, and I was then introduced into the treatment, the necessary infusion of stem cells was done, and I was introduced to the medication that seeks to help the trajectory of regenerating the optic nerves, improving the capacity of my system to analyze what I see and make sense of it. And indeed, by the 7th month, that was December last year, I started to see and recognize colors which I was no longer able to see before I came into the treatment. I consulted telephonically with Dr. Yuri, who said to me, what I am witnessing is a progression from what I was told initially was going to be permanent and total blindness. However, it's important that I understand that that progression is not irreversible. Therefore, I must maintain fidelity to the instructions, to the advice that I was given here at the Institute. And that is exactly what I did. Unfortunately, somewhere along the way, because of distance, the supply of medicine became somewhat erratic, and I then did witness again some regression. But the fact that I had a glimpse at the possibility of progression has enhanced my confidence in this therapy. We have reconnected, me and the European Wellness Center, and I'm satisfied that that reconnection is going to set me once more on the positive trajectory towards improving my ability to discern images, and therefore improve my ability to be independent in doing things that I should do for myself and in service to others, because I have sown myself into a life of service to fellow humanity. Yes, I am using the supplements that were prescribed by the center. I use them every day without fail, and I am satisfied that they are helping me to, despite the fact that my vision is not where I want it to be, to feel that it is not deteriorating further. Well, thanks to my life partner, my wife, I wouldn't on my own be able to distinguish the one medicine from the other. Some of it has to be used in the morning, others to be used in the evening in different doses and so on. On my own, I wouldn't be able to do that. I would be confused indeed. So I need someone by my side to help. So even when I'm in a work situation or I'm traveling and my wife cannot come with, I have colleagues who have volunteered to be shown how they can support me. So I do have really a reliable network of supporters to enable me to take my medication appropriately. Well, firstly, the first session was very good last year. The second session strikes me as even better, because I can see that the staff here, it's really second to none compared to in my relatively long life. The staff I've been working with, medical practitioners in other institutions, but also what I like about this treatment is the fact that both the staff, caregivers, and the doctors, including Professor Mike, make it their business to explain every step which they undertake. So I become enlightened about every element of the treatment and the contribution it makes to the overall plan. It's something that I was never before accustomed to, but I find it to be very empowering, to be made to learn and understand what is involved in the treatment you are receiving. Not at all. Of course, I was apprehensive in the beginning because I didn't quite know what it is. And I expected to go under the knife and things like that. And I find this treatment to be unintrusive, or if it is intrusive at all, it is minimally intrusive. It has to be, because it's a treatment which is looking at the wellness of the human person. I have not experienced anything that I would call discomfort out of this treatment. Yes, you know, this my grandson was born really 2 days before I had an operation that went wrong. And ever since then, if I am to describe the effect of this condition, I am able to see the figure of a person standing in front of me. I can't see their facial details, amongst other things, their eyes. But around December, when I said I started to discern colors, distinguish one color from another, if I look at the books on my shelf, I was able to start seeing differentiate them by colors and so on. I realized that when I look at my grandson closely, I can actually see his eyes. I can actually see his eyes popped up, which I thought was almost like a miracle. And I continue from time to time to check if I can still see his eyes, and I can see them. Well, not quite. What happened was I changed the particular ophthalmologist that I was using because I checked with him if he would advise me to try this treatment, and he seemed to be very doubtful about it. I therefore didn't even tell him that I was going to do it. So the new ophthalmologist that I'm using is aware that I'm on this treatment. I'm using him because I was advised by Dr. Yuri to continue to use chronic medication alongside this treatment. So recently he detected some swelling behind the retina, and he said he wanted to control it because it's important that with the swelling under control, whatever improvements the stem cell treatment is intending to bring about can also be aided by the reduced and actually completely controlled swelling of behind the retina. So he sees complementarity between the treatment he continues to give me and this treatment that I'm receiving here. As a matter of fact, he recently prescribed that I must change the lens of my glass because he thinks that that will also enhance my vision, which is from a relatively lower position to a slightly higher position. I still have to change the lens following that advice. Well, I will introduce others to this treatment because I have come to see the possibilities of improvement, progression away from low vision to an enhanced level of vision. I'm hoping also that I am still to see more than what I have seen so far, and I think others deserve this treatment, and the sooner when people are candidates to this problem, they get to know about the treatment, the better, because then they have possibilities of preventing it from getting to where I am now. As they say, prevention is better than cure.